Healthcare is going through a significant amount of change. That's readily apparent based on you're at the summit. I'm interested to talk to you about data because data is sort of one of the big trends in the healthcare industry. At Optum Analytics, how do you see it playing out over the next few years, and what do you think is going to be the biggest change coming out of it?
I've been involved in healthcare information, healthcare informatics since the late 70s, early 80s, at a time when we used to sell products that do what Excel did and charged a lot of money for those. But the biggest change, I think, is that the basic plumbing is now in place. The infrastructure is in place. The capabilities are there to start harnessing information that historically could not be harnessed. There are still some outliers, spots where things are still paper, but at least in the United States, not globally, the infrastructure is there to start now having access, fingertip access to information that was not there before. As a result of that, there's opportunity. There's opportunity to move from a focus on putting basic transaction systems in place to starting to use information, to use analytics, to enable information-driven decision-making in a variety of places, whether it's at the point of care, whether it's the consuming patient who's looking at information in the home, whether it's the physician, the nurse, the caregivers, across treatment settings, whether it's in the hospital, in the doctor's office, at the pharmacy, in specialty care, and so forth. So I think we're seeing the coming together of an information hub that even a few years ago wasn't possible because everybody was putting the basic plumbing in place.
So you feel like the basic plumbing hurdle has sort of been overcome now. I think the consumer is still sort of waiting. They've been hearing about this change in healthcare and how everything's going to be sort of at their fingertips, and it's starting to get there, but isn't sort of fully realized. So, I mean, do you see any further hurdles, in the near term that will sort of, slow that down, or do you think that we're really sort of now going to see just a sort of a taking off point in terms of the ability for the consumer and end user?
So the half full, half empty of that is the basic plumbing in place, but it's not working. So what's the biggest challenge? The biggest challenge is that unlike other industries where there's efficiency in that plumbing, in healthcare, that plumbing is not all connected. And we've heard that in the various panels and conferences today. That plumbing, sometimes those train tracks go in different directions. So when you take a look at all the systems that hospitals and multi-specialty medical groups and academic medical centers and et cetera have put in place, payers, they don't connect. There's a disparate, hundreds if not thousands of assets out there called enterprise software. And folks have put in various systems, they've upgraded, they've swapped, they've connected. But right now, the challenge is that the burden of getting all that plumbing to flow, for the water to flow, so that the view of the patient, the physician, is all in one place, is not there yet. So there's a significant next wave of evolution required to get that to occur. In the meantime, we can't wait. We can't wait because there's a bubble. The healthcare system has to move very quickly from where it is today to where it needs to go, from a system that is healthcare oriented to health focused. We got to get in front of the opportunities to drive value, to drive efficiency and effectiveness of care. And so you will see a lot of work over the next 5 to 10 years with inefficient plumbing. And so you will see leaks in the system, if you will, to carry that analogy on. But there will be progress. But there will be continued evolution in the infrastructure, in the plumbing system that really accelerated with healthcare reform and Obamacare over the past 5 years. But we're not done yet. We're not done yet.
Do you feel like most of the innovation is more visible for the providers and the insurers and the pharmaceutical companies on that end versus the end user? I think the end user, is sort of minorly, changed, but it seems like there's a lot of sort of things going on with the other parts of the healthcare system.
Yes, the payers, the employers, the providers, government as a payer, pharmaceutical firms, biotech firms, et cetera, are at the heart of using this information. For the first time, we're seeing initiatives where all those stakeholders are starting to come together and working together with that information. It's still a fraction of the opportunity, but in the environment we're moving into with accountable care and organizations taking on risk, you're starting to see stakeholders and constituents working with the same data to try to meaningfully understand what kind of risk they can take, what kind of returns they can drive, and how they can impact health and healthcare. The consumer is still the unknown big opportunity. To your point, today, that stakeholder, which if you think about it, is the only stakeholder that touches all those other constituents, the patient. The opportunity for that individual to touch that information in a meaningful way is still a fraction. It's where electronic medical records were 10 years ago to the corporate world. The world has to come where the patient is engaging with the healthcare system in ways that they are not today. Today, you're still scrambling on the internet. You have dozens, if not hundreds, of choices of information to glean at. You're not quite sure. It's not connected. You still see individuals carrying their x-rays from the hospital to the clinic. You still see tests being repeated because the information doesn't follow the patient from care setting to care setting. And you still see decision-making based on this information being used, but in very disconnected ways by the consumer. So the consuming patient, if you will, is the unknown, I think, next megatrend. I think what you'll see happening based upon mobile capability, based upon the demand of the consumer for more. Why? Because their share of wallet or pocketbook of how much they're spending on healthcare is dramatically rising, and we're not done yet. Their need to understand the choices they have is growing at a very rapid pace. And if you think about it, when you go see a doctor, that's healthcare. That's not health. Health has to occur in the 364 days other than the one day where you saw that doctor, and perhaps other days you've seen other physicians. And the way for health care to become health is for that information to drive your decision making, both with your family, with your physicians, interacting via email, via internet, etc. By having that information, all the information about you, about your options, your choices, about treatment pathways, about clinical choices you need to make, about behavioral decisions you need to make that will make you better, be available. And today, there are thousands of highly innovative startups focused on the consumer side. But what has to happen is that capability needs to be connected to the enterprise data asset that we've been talking about a few minutes ago, and has to create a virtuous cycle, if you will, of thinking and knowing and planning and doing, if you will, that doesn't occur today. So I see a significant move over the next 3 to 5 years of the consumer as the patient taking control of their health in ways that you have not seen today, except in a very small percentage of the population. And I think that as more and more organizations, whether they be providers, payers, etc., take on risk and engage in partnership with other stakeholders and the consumer, it's got to happen. It's not happening fast enough, but it's got to happen.
Data on its own isn't something that necessarily is going to help the patient unless it's personalized, unless it's actionable type of thing. And then
Right.
until it gets to that point, it'll be hard for it to sort of see a lot of change, but it seems like it's moving in that direction.
So just a quick comment on your point about the data.
Sure.
I think the future is where big data intersects small data. Everyone talks about big data. Big data is the aggregate information that you can study, the predictive models that you can create to understand how to reduce congestive heart failure readmissions at hospitals, how to improve the health of diabetics. You can look at that aggregate data, and then your question is, what does that mean for me? Small data is your personal data. And where the world needs to move, and it's starting to happen in pockets, is where the small data and the big data are connected and overlaid, so you can understand you, and you can understand 50 to 100 million Americans, and then look at the cohort that is most similar to you and discover opportunities. That is the next wave of evolution that will occur, but it's not there yet.
When you say opportunities, do you mean just like being able to sort of see, like, okay, compared to, my peer group,
Correct.
My blood pressure, my, sugar levels are definitely either above, at, or
Yes.
below?
And you see a lot of innovation occurring in very specific types of patients. And there are startups addressing diabetes and et cetera, different companies. But what you will see is an ecosystem forming where all the capabilities that allow folks, whether they be patients, caregivers, physicians, etc., to all be able to look at that information in rapid action, because unless it's connected to your workflow, and that workflow means in the doctor's office for a physician or for a nurse, that means specifically in your home at the time you're thinking about this for an individual, etc., etc. Unless it's brought to you in an efficient manner, 95% of Americans don't have the patience, the time, or the knowledge to navigate in an ad hoc manner and self-discover. So it's got to become, we have a lot of these systems in place in financial services, right? And in other markets where you have seen that capability there. So when you're making choices with your mutual funds, there's history, an aggregate for that fund, and then there's your personal information, and you make a decision. That kind of a view is not yet available, and it's coming. It's coming.
Looking forward in terms of topics or areas that you think are not being not getting as much attention that probably deserves so. What do you think the next couple of years really needs to get more attention?
Yeah. So there's going to be a couple of fronts, and if you take a look at some of the innovation occurring out there now, it starts telling you the story of what's coming next, right? Because innovators tend to like to look at a wave but catch it 3 to 5 years before it becomes front and center, because that's how you seize opportunity competitively. And so we now have a significant amount of information clinically and financially and operationally out there. I think the next wave of evolution is going to be a combination of additional data, whether it be behavioral data, whether it be genomic data, etc., data that is not currently captured en masse. That will be connected to all the traditional data that 5-10 years ago was not traditional, like clinical electronic medical record data. And the combination of behavioral data, socioeconomic data, what are you able to do given your socioeconomic status, combined with clinical, financial, operational, is going to form a much broader view of what makes sense moving forward, coupled with advances in technology from a B2C perspective, business to consumer, in the use of mobile devices and the information stored on things like blood glucose monitors, continuous glucose monitors, pushing information so that caregivers can actually see what the diabetic patient's blood glucose is, and actually care coordinators calling that patient to intervene, not when they're at the ER having had a seizure because they're diabetic, but actually intervening proactively while the patient is at home. The same with individuals who are using devices that for pain, etc. So information from devices and a variety of other sorts are going to all start being combined, so that as individuals are moving, if you think about it, you have a phone, there's a lot of things that are tracked because you have a phone. And in general, the internet and mobile devices create a whole new wave of computing and access and knowledge. Health, but we have to really focus on HIPAA and patient privacy and how to protect that. But health information coupled with mobile capability is going to result at a whole different level on how various cohorts, there are almost 150 million people in this country with at least one chronic disease, whether it's asthma or rheumatoid arthritis or MS or diabetes or so forth. The average individual with those chronic diseases is taking a handful or more of pills a day. A lot of stuff happens when they don't take their meds, when they're not compliant, when they're not adherent with that medication. You're going to see a whole nother level of engagement of how the patient, the care coordinators, and the physicians are aware of what's going on with data, with devices that are moving information using RFID technology and so forth, and an awareness level that creates an interaction process that is much more significant. The challenge there is the payers need to catch up, and the payers need to start reimbursing for health, not for health care. Today, that is not yet prevalent. It's starting. There are certain health plans that are starting to reimburse for telemedicine and so forth. But right now, when I interact with my physician via the internet, he's not making any money. And so his motivation is to get me in and see me, when in fact, I need to talk to him on Thursday at 8 o'clock, not in 3 weeks when I have a visit. So the economic reimbursement system, healthcare is very nuanced in that those who pay, those who deliver, and those who receive, there's a three-legged stool there that's very different than almost any industry, and that creates slowness in the traction required to make this happen.